Home remedies for carpal tunnel syndrome. Carpal tunnel syndrome, CTS, is a condition affecting the hands and arms that causes tingling sensations and numbness at the initial stage. As it progresses to advanced stages, it may lead to severe pain and weakness in the hands and even cause nerve damage. CTS can occur in one or both of hands and is generally more common in women than men. The cause of most cases of CTS are unknown, however it is usually due to excessive pressure on the median nerve that travels through the wrist at the carpal tunnel. A number of factors can contribute to CTS, such as the anatomy of your wrist, repetitive use of the wrist, an injury, workplace factors and nutritional deficiencies. Certain medical conditions can also increase a person's risk. Such medical conditions include diabetes, thyroid dysfunction, fluid retention, high blood pressure, obesity, pregnancy, kidney failure, menopause and autoimmune diseases like rheumatoid arthritis. Advanced stages of this condition may require medical attention. However, home remedies can reduce symptoms and help restore wrist and hand function in mild cases of CTS. Here are some home remedies for carpal tunnel syndrome. Cold compress. For temporary and quick relief from inflammation and numbness caused by CTS, you can use a cold compress. The cold temperature will help relieve pain by numbing the affected area. It even reduces swelling and inflammation. Put a few ice cubes in a plastic, sealable bag. Wrap the bag in a towel and apply it on the affected area. Leave it in place for about 10 minutes. Repeat every hour or so, as needed. Note: never apply ice directly on your skin. Massage therapy. Massaging your hands and wrists is another effective way to alleviate some symptoms of CTS. It will activate the pressure points on your hands, which in turn will increase blood supply, relax stiff muscles, improve mobility and reduce pain. Rub some warm coconut or olive oil on your hands and wrists. Massage your arms, wrists, hands and fingers with gentle strokes for 10 to 15 minutes. Do this 2 or 3 times daily until you notice improvement in your condition. You can get help from a massage therapist, also. Note: do not massage if your joints feel too tender or painful. Epsom salt. Epsom salt is a natural muscle relaxant and anti-inflammatory due to its magnesium content. It can effectively relax the tightened muscles in your hands and wrists. Mix half to 1 cup of Epsom salt in a deep tub with warm water. Soak your hands and wrists in it for about 15 to 20 minutes. Use this remedy 2 or 3 times a week until you get relief from pain and stiffness. Castor oil. Castor oil is another good remedy for treating CTS. It can help reduce inflammation, suppress pain and restore normal functioning in your wrists. Warm some castor oil and apply it on your hands and fingers. Massage your wrists, thumbs, fingers and the back of your hands for 10 to 15 minutes. Wrap your hands in flannel and leave it on for an hour. Do this once daily for a week or until there is improvement. Acupressure and acupuncture. Acupressure and acupuncture therapy can also help in the natural treatment of carpal tunnel syndrome. It helps restore normal nerve functioning and provides relief from pain. In fact, it is a good option for those who want to avoid early surgery. Acupuncture therapy to be helpful in reducing the symptoms of CTS. There are specific acupoints on your wrist and elbows, for example, pericardium 6 or PC6, that you can press gently for a few seconds using your thumb and forefinger to promote the flow of energy and restore range of motion. Stretching exercises. It's good to flex, rotate and stretch your hands, wrists and arms several times a day when suffering from CTS. This helps increase blood circulation and may also alleviate some of the symptoms. Stretching exercises are easy to do and can be done while sitting at your desk, waiting in line or whenever you have a few minutes to spare. Make a fist, release your hand and shake out your fingers. Repeat 5 to 10 times. Put your hands in prayer position. Spread your fingers apart and keep the tips touching the fingers of the opposite hand while you open and close your palms. Do this for 5 to 10 minutes. Shake your hands as if you are trying to air dry them for 5 minutes at a time. Ask your doctor about more stretching exercises that can increase circulation, movement and mobility of your wrists and hands. Blackstrap molasses. Blackstrap molasses is a good source of magnesium that aids muscle relaxation. The nutrients like iron, B vitamins, calcium and potassium in it also help maintain good blood flow throughout the body, including your hands. Mix 1 to 2 tablespoons of blackstrap molasses in a cup of warm milk. Drink this once or twice daily until you notice improvement in your condition. Flaxseed oil. Flaxseed oil, also known as linseed oil, can help alleviate pain and swelling in CTS, mainly due to its analgesic, anti-inflammatory and antioxidative effects. It is extremely rich in omega-3 fatty acids, which reduce inflammation. Linseed oil is effective in the management of mild and moderate CTS. It helps improve the severity of symptoms and functional status. Apple cider vinegar. Another effective home remedy is apple cider vinegar, which helps reduce inflammation and pain, two common symptoms of CTS. Furthermore, it is rich in minerals like magnesium, calcium, potassium and phosphorus, which are essential for strong muscles and bones. Add 1 tablespoon of raw, unfiltered apple cider vinegar and a little organic honey to a glass of warm water. Drink it twice daily. Also, mix equal amounts of raw, unfiltered apple cider vinegar and olive oil. Use it to massage the affected area 2 or 3 times daily until you notice improvement in your condition. Vitamin B6. Vitamin B6 as part of complementary treatments to postpone hand surgery in those suffering from CTS. As vitamin B6 plays a key role in neurotransmitter synthesis and amino acid metabolism, it is essential to include more vitamin B6-rich foods in your diet. Some foods rich in vitamin B6 are bran, pistachios, salmon, tuna, sesame seeds, sunflower seeds, hazelnuts, raw garlic, oatmeal, wheat germ, and brown rice. You can also take vitamin B6 supplements, 50 to 100 milligrams twice daily, after consulting your doctor. Additional tips. Eat antioxidant-rich foods like blueberries, cherries, tomatoes, squash and bell peppers. Include turmeric in your diet. You can also take it in supplement form, 300 milligrams 3 times a day. Use healthy oils, such as olive oil for baking or frying. Avoid red meats. Eat more lean meats and cold water fish. Wear a wrist splint at night, but make sure it is not very tight. When typing or using a mouse for an extended period of time, make sure to use a wrist pad. Keep your arms elevated while sleeping. Avoid sleeping on your hands. Quit smoking as it promotes the blockage of narrow blood vessels and worsens the symptoms. Take regular breaks from work that include strenuous or repetitive hand movements, such as clicking a mouse. Stop activities that may be causing numbness and pain. Do yoga exercises that are designed to stretch and strengthen the joints in the upper body. Improve your posture to reduce your risk of CTS. Keep your hands warm by wearing gloves, especially on cold winter days.